Okay. Smile morning to all the online participants. Welcome. Can we have a feedback? How was it yesterday? What do you want to be changed? How do you want it differently? Have any doubts? There's my Padawan listening. So, good morning, Padawan. Yeah. Okay. So, if there are no doubts, that means either everything has been understood or nothing has been understood. But that's okay. It's okay. Please feel free to reach out to me if you have any doubts, if you have any queries, if you have any questions. And the only reason is I don't know how to reach out to you. I'm not a very social person. I prefer to stick to myself. I don't know the art of mingling with people. But if you have any requirements, then I'm duty bound to clear that for you. So please do reach out. I'm an introvert and I'll come here, do my job, go out there and probably stand and pull out something and be with myself. Okay? So let that not stop you from getting what you really are entitled to. Okay? Yeah. So we have seen a lot of things for the last three days, and today is going to be an easy day because this is what all you're looking for. This is the utility part. And for the utility part, we have made the preparations. Some of them have been interesting, some of them have been boring, some of them will appear a little tough to understand now, but if you go in the long run, you will see that everything will gel into place. Okay? So if we look at the beginnings in Sujok, we know that the human hand contains representation. Hello? Yeah. We know that the human hand contains representation of the whole human body. The human foot contains representation of the whole human body. And whatever problem we have in the human body, we treat it, we do the treatment in the hand or the foot. We don't do it directly. That is why it is called as a correspondence system. It's an indirect way of reaching out to the pathology so far away from the body. Yes? Now, you'll also see that based on the similarity phenomenon, the ear resembles the human fetus. And all we have to do is superimpose the human fetus onto the human ear. And when we find that representation, we just have to do the treatment. The treatment can be either a needle, different types of needle. It can be a magnet. It can be a seed. It can be a color. Right? It can be a laser. Or it can be an electrical stimulation. Whatever it is, the choice of treatment is left to you. So what we are going to do today is we are going to understand the different representations that Professor has given to us, the different ways that the human body can be represented on the human ear. Now for this, he has really thought about it. He didn't look at one theory. To make things more powerful, when you go to war, do you fight a war with just one arrow? No, you need to have multiple arrows. And you put all the multiple arrows and you put it into the quiver, and then whatever the kind of enemy is, you remove that arrow and start firing it. Right? With the hope that the enemy is defeated. Okay. So this is what I've been trying to do for the last 3 days, bring in various theories that you can combine so that today's part will be more powerful and you can understand much better. Right? So what are the theories that Professor combined? The human ear is here. Dr. Paul Noguer saw that the human ear resembles an embryo or a fetus. He put one representation, he left it there. Then so many other people came, they did their own experiments and they added multiple points to that. That became popular and that's ruling the roost now. But Professor, and I fail to find logic there. Not that it doesn't work. I fail to find logic. You'll have to sit and memorize, keep a chart in front of you, and every time refer back to the chart. The beauty with Professor Park is that he gave us a very systematic approach. The flip side here is the presentation that is given there is pretty averse. It's not reader friendly. I'm honest in that. Okay, so let's make it reader friendly so that we can understand the power and potential of his genius. That's the first thing. So the theory that he combined was the fact that this can contain representation of the human body is clear. Next, he looked at, since this was an embryo, it is not a full grown human body. It is an embryo. It is a fetus. That means it is inside the womb. Okay? And when Dr. Noguer put that embryo on the ear and left it at that, he said, why not build upon it? So primarily, he brought in the theories of embryology. First thing. In embryology, there are two phases. One is the head up stage, one is the head down stage. And he coined a new term called the hetero and the homo. Okay? To explain the head up and the head down phenomenon. That is his way of explaining. So first he brought in the theory of embryology, one. Second, he already had the theory of 6 key or the 6 energies. Now before this, we were all interpreting diseases in terms of 6 key. For example, if somebody had a prolapse or a polyp, they would say your humidity excessiveness. If somebody, used to do haphazard thinking, we would say your originality excessiveness. We would interpret any and every disease in terms of 6 key and then do the treatment on either the biomeridian or chakras or on whatever it is and get our results. The condition used to be resolved. And this is true for every science. Ayurveda looks at it as Vata, Pitta and Kapha. Yes, that is their own way of learning and it's their own way of interpretation. Unani looks at it in a different way. Homeopathy looks at it in their own way of understanding. So we in Sujok, as Professor has given us, till that level, is we interpret any and all diseases in terms of 6 key. And that is what we need. So first we will need to understand what 6 key is. So when he brought in the theory of embryology and he combined the theory of 6 key, he could get multiple options. Noguer just gave us one option. He gave us one representation and that's about it. But Professor gave us multiple representation by a combination of the theory, by combining embryology and 6 key. Now that is what we are going to learn. And from here the easy part starts. You ready for that? Yes? Okay. Now I have an admission to make. To be very honest, Dhaval and Pavanji, we keep talking. He says, why are our books coming from the outside and not from within? Okay? Whatever the reasons are, the figures in the books are, they were written 30 years back. I have made an effort here to bring to you real-time anatomical figures. But the process is still going on. It's a very tedious process. Okay? And correspondence is pictorial based. You need to see the pictures to understand. Okay? And when I look at anatomy and when I look at embryology, there are multiple pictures that I can give you. Because if you look at the various correspondence system, we will not know that the human heart or the human kidney or the human liver or the human brain can be represented here unless we have a visual image of that. So I have tried to recreate a visual image that is anatomically correct. That means you go to a standard medical textbook and look at anatomy. The same anatomical representation to the same dimension is something that you will be able to get on the human ear. I've tried to recreate that so that it's going to be easier for you. Because in some of the figures, there is a slight variation. So we have tried to correct all that and give you an accurate picture. But the sad part is I have not been, Dr. Firdaus and me, we have not been able to finish the entire book. So whatever we have done, we will share it with you. It's in the PPT. The rest, we will go by the textbook. Would that be okay? Yes? Okay. Yeah. So we need to understand how we are going to represent the human body and the human ear. For that, we need to study what is called as anatomical position. Yes? So in the anatomical position, how do you see? How am I standing right now? Upright. Okay? If I put my head down and my leg up, that is also upright? That's upside down. Why? Which is my right hand? Which is the right for me? This one? But how do you see? When you look at me, which is my right? This one. So there are going to be a lot of confusions. To avoid all this confusion, we have what is called as a baseline position from which you need to view your subject or your object. I am your subject now. Your correspondence is your subject. You need to view that in a baseline position, and that baseline position is called as an anatomical position. Are we clear on this? Yes? Okay. So in human anatomy, when we stand like this, the anatomical position will be like this, of an erect man, of an upright man, with the palms facing front and looking straight forward. Hmm? Yeah. Okay. So we stand like this. So when I face you, what is this called? How do you address this? What is this? Anterior. Yes? This is the front or the anterior. These are terminologies which professor has used in the book. So please understand that anterior means the front of the body. What is this? Okay? Posterior. Now don't tell me this is anterior because this is facing you. The baseline position is starting from here. This is anterior. No matter how I stand, this still is anterior and that is posterior. Okay? Now, once the anterior and the posterior are clear, what is towards this side? Okay. Francesco, can I have everybody else speak? Yeah? No, don't shut down. Okay? I want to take everybody together. ये सबको साथ लेके जाना मुश्किल है, बट हम लोग फौज में बोलते हैं कि never leave a buddy behind. Okay? When you go out into the enemy territory and somebody has a bullet injury, we put him on our shoulders and walk back into our own friendly territory. So we have a buddy. He's the one who takes care of us. He looks out for me, I look out for him. So we never leave them behind. So I don't want to leave you behind. I'm okay to spend some extra time with you, but there is no point in leaving you behind because it cuts a very sorry figure. That's not the way I work in life. Okay? Yeah. So this is the anterior, this is the posterior. Now, how can we divide the body? How can we divide the body? Hmm? No, simple words. Okay, we have the right, we have the left. Yeah? You can dissect the body in the middle. Yes? You call it as a vertical. But what is that dissection called? How do you dissect it? There is a name for that. For us to get left and right, how do you do that? We had given you homework. Please answer. Hmm? Yeah? Okay, there are three ways to. Hmm. Why do we call it as the sagittal axis? Why do we use that word sagittal? Sagittal is, if you look at the skull, if you look at the cranium, you will see there are sutures here. Okay, this suture which comes like this anteriorly is called as the sagittal suture. So that is the reason why when you dissect the body into your right and the left half, the marker is the sagittal suture here, and that is why we say it is a sagittal plane. The sagittal plane divides the body into the right and the left half. If you draw it in the center, it is called as a median. Yeah? The sagittal plane is also called as a median. So when we dissect the body medially, I'm using the same word. Median is here. When I dissect it medially, that means I'm dissecting it into two equal halves. I get the right half and the left half. Okay? There is also another suture in the cranium which is called as the coronal suture. The coronal suture, the name coronal plane comes from the coronal suture on the cranium which dissects the body into the anterior and the posterior. Are we clear on this? Any time of the day, sagittal, coronal, sagittal, coronal. Sagittal is left, right, coronal is front, back. Clear? This should be on the tip of your fingers. ये भूलना नहीं है. Sagittal is left, right. Why? Because sagittal sutures. Coronal is front, back. Clear? And this is called, the midline is called median. Anything towards the median is called medial. Are we all aware of this? Yes? Anything towards the median is called medial. And they are subjective. They are not absolutes. Anything towards the median is medial. Anything away from the median is lateral. Okay. Now we look at the trunk here, and there are protrusions or attachment coming out to the trunk. So when we look at the human body from that angle, we use two words, or we use a couple of words. One is we say distal. What do you mean by the word distal? Far away, further apart, further away. Further away from what? From some point. What is that point? Exactly. You see, all of you know it, but you need to express it. Okay? Distal is further away from the point of attachment to the trunk. This is distal. And nearer to the point of attachment is called proximal. Right? Okay. So distal and proximal is over. Then you have something which is here and something which is below. What is that called? This is superior. This is inferior. Okay? Then you have something that is located here and something that is located inside. How do you address that? Whatever is located outside, whatever is accessible outside is called superficial. And whatever is inside, it is called deep structures. Clear on this? Any other terminology that I have forgotten? Caudal means tail. There are multiple ways in which you can address. Okay, so right now we say this is the superficial part or the superior part, but when it is top, what is available here? What is this? It's called the cranium. Okay, or the skull. The layman uses the word skull, but technically we call it as the cranium. So this is the cranial surface, which is towards the head, and this is the caudal surface, the bottom, the tail part. The cranial and the caudal. Right? Now, we have the anterior and the posterior. There is another name for that. What is this called as? This is called as the palmar surface. And what is this called? Dorsum. Where is the plantar? This is the plantar surface. And this is the dorsum of the foot. Clear on this? Okay. So you will see the posterior is also called as the dorsum because it is exposed, and the front is also called as ventral. This is not a very commonly used term, but the dorsum is something that we generally use. Okay? So we have divided the body via the sagittal plane that gives us the left and the right. Yes? And the coronal plane which gives us the front and the back. Done. Now can we divide the body in any other way?
Yes.
Yes. How?
Horizontal plane.
The horizontal plane. Yeah. Double. It's not going. नहीं चल रहा है. Excuse me. If you remember and understand the terminology, superimposing it is the easiest part. So this is over. The next is you're cutting it. You're cutting it is not the right word. You're dissecting it. You're dissecting it anywhere. Here, you see this? This is called transverse. You're traversing through the body. This is called the transverse section. And this is the median, this is the sagittal section. And this is the frontal or the coronal section. This is clear? Okay? This is done. Okay. Now, I want to bring you to the model here so that it's easier for you to understand. I have said this the other day and some of you came and told me, sir, it was very confusing. We will repeat that now. Okay? Just for the sake of understanding. This is the, what is this? This is the human ear. The right ear or the left ear? Okay. Which ear is this? This is the left ear. That's just for an easy understanding. Okay. So if the ear is here, in how many different ways can I superimpose the human body? 4. Generally 4. Okay. So you will see that take the ear like this, you represent it like this. Yeah. So what is it called? The coronal presentation, the sagittal presentation? The coronal. Why? Front and back. That means the front or the anterior of the body will come on which surface of the ear? Will come on the lateral surface of the ear. And the posterior of the body will come on the dorsum. No, okay, dorsum is also okay, but we call it as a medial surface. See, these words are interchangeable, and in practice we generally, there is no clear-cut reason why we say the lateral and the medial, because we compare it in relation to the median. We don't say dorsum of the ear, we say the medial part of the ear or the posterior part of the ear. Okay, generally we use the word dorsum for the back, the dorsal area, or the dorsum of the palm, the hand, or the foot. Okay, you will get this by practice. You stay in the community, people will start using it, and then you will get familiar with that. It's not wrong, but it's less used. Okay? Okay. So what is this presentation? The front back presentation is called as the coronal presentation, wherein the anterior part of the body is represented on the lateral surface of the auricle, and the posterior part of the body is represented on the medial side or the posterior side of the ear. This is one. Now if you present it like this, this is what? This is the sagittal. In the sagittal, what is the representation that you're getting? Hmm? Right and the left. So the right side of the body is available on the anterior or the lateral surface of the ear, and the left side of the body is available on the posterior of the ear. Okay? These are the only two ways that you can represent.
Sir, when you said the left part of the embryo
Hmm.
is represented on the, you said the medial part on the posterior of the ear or the medial part of the ear?
The posterior and the medial is one and the same, no?
It's the same there, right?
Yes. See, this is posterior. If this is lateral, what is this?
Side is
It is nearer to the median, so
medial.
it is medial. Okay? Okay. For me not to confuse you, do you want me to shall we stick to one simple term, front, back, left, right? Would that be okay? Huh? Yes, we will. Okay, it's okay. कभी ना कभी आएगा जब हम लोग anterior, posterior, dorsal, ventral, we'll play around with those words. But you work at that. You have got the theory, right? So shall we stick to front and back and left and right? Yes, instead of coronal and sagittal and things like that. Because yes, okay, ठीक है. So this is the front of the ear. This is the back of the ear. Back is not the right word. Okay, but okay, it's okay. So the front and the back. So if you hold it like this, you have the right and the left. Okay, this is one interpretation. Now, when you add in embryology, you will see that there are two stages of growth. The first one is the head up stage. The second one is the head down stage. Yes.
Yes.
So you have the same representation here. Now, when you bring in the sixth key, you will have 6 different interpretations. Are you getting it? So you will have left, right, head up, wind, heat, hotness, humidity, dryness, and coldness. You will get 6 different correspondence system in the head up, in the left, in the left, right. Then you will have 6 more in the head down, in the left, right. In the front back also you will have 6 plus 6, 12. And you will have correspondences which are related to the 6 key. So you know the classification of the 6 key, you know what are the wind conditions, you know what are the heat conditions, the hotness conditions. All that you need to do is identify the correspondence system, find out the organ that is problematic. Suppose somebody has got osteoarthritis of the knee. It is a dryness condition. So you will see the dryness image here. All you have to do is find out the painful point, insert the needle. As simple as that. Then he gave us another term. Okay. Generally, in embryology, the first stage is the stage where a lot of growth happens, the organogenesis happens. Now, if you look at it in terms of triorigin, when there's a lot of change happening in the human body, what do you call that stage as? Hetero. So he said the head up stage is the hetero stage, and when the organogenesis, when the organ is fully formed, or rather, it's stably structured during birth, it comes down. When there is a normal presentation, the finer functions are being developed. That is the homo stage. Right? This much is clear? Shall we go into some theory?
Yes.
Yeah? Okay. Dhaval, can I have the theory? Okay. This is clear? Okay. So, there are 6 stages in the intrauterine growth, intrauterine or in vitro. It is a uterus, right? The growth is happening within the uterus, so it is intrauterine or in vitro. 6 stages in the intrauterine growth of man. Why 6 stages? 6 key. Okay. The auricular correspondence system bears the closest resemblance to the human body in its developmental stages. In the developmental stages, we are developing in vitro. Each stage of intrauterine growth can boast of an independent system of its own. You'll have a wind system, heat, hotness, humidity, dryness, coldness, also brightness and lightness, brightness or lightness and darkness. Okay, if you look at it in terms of 8 key, independent system of its own. The process of development is influenced by the combined action of the homo and the heterophores. Homo and the heterophores means head up and head down. And the hetero is fast changing, the hetero is dispersion, the homo is slow, the homo is gravitation, homo pulls everything, homo is it doesn't allow anything to change. Hetero changes very fast. So if you look at it in the hetero condition, there are possibilities where one can develop congenital anomalies. You can have teratomas, not in the homo state. We will compare that to embryology. My notes on embryology are coming. I will give it to you. You can, if it interests you, you can please build upon that. The handwritten notes. Okay. Yeah. Okay. So the homo action of the homo and the heterophores. The homo state is hard to perceive, just manifested, low variable, latent and inert. It is like the feminine, not coming up the front, not very volatile, slow and sedate. All the changes during the homo phase you really cannot appreciate because they happen very gently and slowly. But during the hetero stage, you will see that growth, development happens very fast. It is very prominent, it is clearly manifest, it is variable, it is active, and it is speedy. We looked at it in the yesterday's embryology when the chart will come up again. If you calculate the number of days, you will see the number of hetero days are more because growth is happening. The phases need to change. The homo period is slower, it is lesser in nature because most of the growth has happened, only the finer functions are yet to happen. Okay, so it's gentler there. The homo force mainly controls the early life cycle or the prenatal. Now, there is a slight, professor professor classifies. When you look at the triorigin, he says this is homo in homo, this is homo in hetero, and things like that. He gives you a layer form. You're aware of that? So here also you will see a layer form. So don't confuse yourself. Okay? And listen to his wordings. The homo force mainly controls the early life cycle of the prenatal period. What is prenatal period? Before birth. So everything in vitro is homo. The hetero force largely controls the postnatal period. Yes? So after birth it is the hetero life. So that means this. See, he had not yet developed the neuter concept. So in vitro is we are looking at this is a homo type of treatment. Yes, according to the auricular therapy book 1. Why? Because it is intrauterine, it is in vitro, it is inside, it is hidden, it's not happening externally, it is not visible. So basically it is a homotype. Let's look at the triorigin classification later. Let's understand it the way he has given and then we will reinterpret that in terms of triorigin. Okay? So since it is, yeah.
But the very first part is hetero because it's changing. Then
That,
it gets
yes,
hetero
yes, yes.
before,
Francesco,
before the birth.
yeah. No,
Then gets again hetero.
homo is hidden. Yes? So the growth is hidden inside. It is happening within. That is why it is homo in nature. The minute one is born, it is visible outside, it is external, and it is hetero in nature.
I understand.
Okay?
Because it moves and everything.
Yes.
Okay, but in the intrauterine period, the very first phase is hetero.
We are not coming to that phase. We are just talking about two divisions. That's why I'm telling you, listen to this. The homo force mainly controls the early life cycle of the prenatal period. Prenatal is everything inside. Head up, head down, homo, hetero, everything. It's a broader classification. In the prenatal period, it is homo. Postnatal period, it is the hetero stage. Right? Now, even here, when you come inside, when you come inside, now this is the homo system that we are targeting. In the homo system, you have seen the cross section of the uterus, where from the ovary the oocyte is developed before fertilization. There are two parts here. One is the gametogenesis. That means the egg has to develop, the egg has to come into the fimbriae, it has to come into the ampulla, and from there it has to be fertilized. Yes? That is one journey of the egg. The second journey starts after fertilization. Are we understanding it now? Okay, so before fertilization involving gametogenesis, which is homo in nature. After fertilization, it is hetero in nature. Are you looking at the beauty in which he has classified this? This is the homo system, this is the hetero system. Yes, in the homo system, before fertilization, it is homo in nature. After fertilization, it is hetero in nature. Now, in that hetero, again, he has got homo and hetero with the head up and head down. Are you understanding this? Or is it confusing? Sharma ji,
No, sir.
clear? Okay. Now, I need to build up step by step. Till here, are we clear? Before fertilization involving gametogenesis, which is homo in nature, and intrauterine growth, which starts from fertilization up to delivery, is hetero in nature. Okay? Let's go front. Okay. Now, along with the functioning of the homo and the hetero forces, the six energies or six ki are in simultaneous and successive circulation, aiding in the development. The process of development is influenced by the simultaneous action of the homo and hetero forces and the six ki, which are independent and successive processes. That means they happen together. It's not one after the other. They go hand in hand, they go together. When we reach up to the correspondence, we will see how they go hand in hand together. Because in vitro, the body will be developing the limb, the body will be developing the kidney together. It is simultaneously it is happening. Yeah, the kidney is not formed here. The kidney will be formed somewhere here, then here, then here. So it moves. It happens simultaneously. They are independent of each other, but they're happening simultaneously. They're happening together. So this is his way of explaining it. Okay. So influenced by the simultaneous action of the homo and hetero forces and the six ki, which are independent and successive processes. Any unit of existence will have a starting point. Okay, a rising and a declining phase. The starting point of growth will be homo, or what is before homo? No, don't go to Newton.
Hetero.
No, darkness.
Yes.
Do all of you have the textbook of auricular therapy, volume 1? You have it? Okay, we might need it. Okay, so you will see his interpretation here is before homo there was darkness. Okay, any unit of existence will have a starting point, a rising point, a rising phase, and a declining phase. The starting point of growth will be homo. Okay, in the homo you will have wind, heat, and hotness, which is the extension cycle. Reaching the hotness, which is the culmination of the hetero phase. Any unit of existence will have a starting point, a rising and a declining phase. Okay, the starting point of growth will be the homo. So the minute the homo starts, what do you need? Wind. Wind, heat, hotness, which is the ascension cycle. The reaching of the hotness is the culmination of the hetero phase. This is where growth happens. In the homo, the growth is happening, so it is hetero. Clear? Okay. Now, the descending stage will start with excessive humidity. You will see excessive humidity is at 30, 40 and things like that. That is when the body fat starts coming. That is when the obesity starts. That is when sluggishness starts. That's the starting point of decline. Yes? Okay. We'll start with excess humidity, proceed with dryness and coolness, indicating its return to darkness of the homo state. This is the first kind. This is one kind of circulation. And we have studied this. Wind, heat, hotness. This is the humidity, dryness, and coolness is according to the 6 ki, but according to the 8 ki, it is darkness here and brightness or lightness. Fair enough? Okay? And this is successive. This is the first kind. This keeps repeating in life. Every pathology will have a creation cycle like this. This is the function. Every disease progresses wind, heat, hotness, humidity, lightness, humidity, dryness, and coolness. This is the first kind of circulation. The second kind of circulation, each kind of circulation will have its own benefit. It has got its own purpose. One needs to understand the geniusness of professor that he takes 6 key and compares that to processes which are medically established and explains to us in the theory of Sujok. It's very unlikely for somebody to do it so fast and get so many theories together and yet, concretize them. Okay, I feel I really missed out not attending his seminars. I regret that today, but that's okay. Another cycle with a greater scope based on the eight origin circulation is unidirectional in nature. It happens once, unidirectional. It is characterized as having two stages: successive increase in the intensity of energy or growth, the ascension cycle; successive decrease in intensity of energy and growth. Grow, decline. There are only two things. Okay. The first of this growing cycle will provide for expansion and advancement, sophistication, rising where the homostate is followed, homostate or darkness is followed by coldness. Are you understanding this? Coldness, dryness, and humidity, where the homostates end. Any difficulty? What is coldness? What is darkness? You close all the lights, it is darkness. There is no heater here. It's very cold. So in darkness, the next energy that is there is coldness. Okay? If you move away from coldness, what do you get? Dryness. A little away from dryness, you get humidity. This is the peak of the homo area. This is where homo ends. Now once homo ends, what will start? Hetero. And where does hetero start? What does he do? Does he keep quiet? No, what does he do? He moves. The hetero state will start with wind, then heat, hotness, and culminate at lightness or brightness, which is the ultimate hetero stage. This hetero stage of lightness will be the starting point, starting homo point for another process of growth and development. It has to be successive, right? But we use this circulation in embryology, and that happens to us once in a lifetime because that's the creation, that's the process of birth. That's how we are all born. Does it happen every time with us? Are we born every time? Probably if you look at a cell, if you look at apoptosis, if you look at cell growth, there we can apply that. But not in the human organism, birth happens only once. But if you go layer by layer by layer, you will see anything that is damaged, anything that is growing, anything that is regenerating will follow this cycle. So it gives us one advantage, that this cycle can also be used for regeneration. We have not even touched embryology, but the very strength of the theory wherein he says the hetero stage of lightness will be the starting point, starting homo point for another process of growth and development. From a single cell, we are becoming an organism, and that should end the cycle. Yes? We should not need the cycle again. But then we are growing hairs. How does the hair start? Zoom, it comes like this? No. It starts with a small follicle and slowly comes up. It comes up like this. It follows this cycle. So this is a cycle which has got enormous potential for regeneration and redevelopment. At the basics itself, it has got that strength. Because we are a resultant of this cycle. If you go to, and this is how it is. The hetero stage will start with the wind, heat and hotness, and this is double has come. Okay, yeah. So how does it? This circulation starts with darkness, coldness, and dryness, which is the homo stage. No, we will not. Darkness is available. Coldness, dryness, and humidity is the homo stage, and wind, heat, and hotness and brightness is the hetero stage. This happens for us once because this is the cycle of birth. But if you look at all sorts of regeneration, tissue regrowth, how does the liver grow, all those things you can get into this. This is something that is again not visible. Is it visible? Do we count which hair falls and which hair grows? Don't. Do we see which blood cell dies and which blood cell comes up? Do we know which cell in the liver passes away or which liver cell is regenerated? We don't know that. But don't you think it follows all this stage? Okay? So on when you observe the human being, this is a one-time happening, but if you go deeper into the human body, this is repeating at different levels. We will be studying, correct? We will be studying this circulation in comparison to birth cycle, wherein we have the correspondence system which is placed in the human auricle. Then there is another kind of circulation, should be the third, okay, which is another again unidirectional and signify the stage of destruction, degradation, decline. This cycle is responsible for unidirectional reduction and contraction. We are all potent. We claim that we are omnipotent and so on and so forth. We generate a lot of ego. Okay, I am this, I am that. Everybody is subservient to me and so on and so forth. But we know that time is something that can really knock us down. Okay, everything is transitioning. Nothing is permanent. I was reading the newspaper the other day. The Fly King. Who is the Fly King? The king of all, not Vijay Mallya. The Naresh Goyal. Have you heard of Naresh Goyal? He was called as the Fly King. Jet Airways. Today he's behind bars and he says, don't take me out. Don't leave me out of the jail because I will die because I'm bankrupt. Everybody will come and kill me. So let me at least live here for some time. He was a high-flying big shot there. You see how time humbles you? Nothing is permanent. The only thing that is permanent in life is change. Everything, yeah. The only thing that is permanent in life is change. Okay? So you will see that in this unidirectional, the stage of decline, we all start with lightness or brightness. And then the decline happens with hotness, heat, wind, and then comes down to humidity, dryness, coldness, and darkness. This is apoptosis. This is cell death. Yes? They say that the darkest hour is just before dawn. Clear? So this is the cycle of destruction, or I don't like to use the word destruction, probably decline or the phase of going back to where we came, wherein we are shining high in lightness, hotness, heat. See here you are seeing generally heat and hotness comes up like this. How do we fall from grace? We fall like this. How do we rise up to grace? We rise like this. You see the flower there? The flower also slowly blossoms like this and then comes down like this. Yes? This is the stage of decline. Lightness, hotness, heat, wind, then humidity, dryness, coldness, darkness. Okay? It starts with lightness or hetero, hotness, heat, wind, humidity, dryness, coolness, and darkness. The darkness state will then become the initial hetero for the next stage of contraction. Down, 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 down. Go back to the source. It's so beautiful. When you sit, when you understand this, when you apply these principles to life, the whole dynamics change. The perception to life changes. But it is up to you to apply it. Okay? Everybody says tri-origin is applicable here, there. Every theory that he has given is applicable to every day, time, minute, second of our life. The more you jump into that, in everything you will see 6 key. In everything you will see homo and hetero. Before the homo and the hetero came in everything, I used to see the yin and the yang. When I used to teach, that was 25 years back, I would stand outside and look like this. I would see somebody and say, this is a wind person, this is a heat person. How do I clarify? So I would go and ask him, suppose it was a lady, I would go and ask him, do you have heavy, first I would introduce myself and say, ma'am, I'm Dr. Prabhu, so on and so forth. Can I ask you a medical question? I'm doing research. Okay. Do you have heavy bleeding during your cycle? The lady will look at me and walk away like, who the hell is this fellow asking me such a personal question? You ask them. Some of them will oblige. Sir, how do you know? No, madam, I'm doing some research. Can you help me? So somewhere, doing all these things, I started collecting data. Because that was the only way that I could build up. Okay? I would go look at a very slim person and, he will shave early in the morning at 5 o'clock and say, "Sir, do you have constipation?" How do you know? Who are you? "No, sir, I'm doing this," because he's a dryness condition. Okay, so in dryness condition, he will have, he may or he may not have constipation. How do you validate that? You have to ask. I don't have a lab here. So I use my small head here and ask them the question. He has given us a theory. How do I validate that? How do I become confident with that? I don't have so many patients. Right? So do you suppose I see a small child or somebody walking, running, I ask the mother, "Madam, in the evening does he have a lot of spasm?" "Yes, he has a lot of spasm." Uluku, in Kannada we say uluku. Okay? Does he have that spasm? "Yes." "How do you know he runs here, he runs?" "Yeah, that's his nature. He does that. And that is why he's getting the spasm. I'm proving the theory here. So thereby you compile that. So the best way to learn is not from the book, but stand out in nature. If you look at the leaf, if you look at the tree, you will see the homo, the hetero, the yin and the yang, the wood, the fire, the earth, the metal. Everything is available there because it's from there that it came into the books. Now we have lost touch of that and we are getting into books. So once you look at this, go back into Mother Nature, go back to your patient, look at it and see what he has given to us. So this is the cycle of destruction. This is the cycle of decline. Okay?
Sir,
Yeah.
you are telling about the life, the cycle of the life, right?
Yeah.
How darkness succeeded by hetero? Why darkness is the issue, the face of the hetero? If somebody is dead and not
So how is darkness the starting point of something, right? Okay. Have you looked at the origin of life in your book?
yes,
What is there in the beginning? What was there in the beginning?
darkness.
Okay. Then after darkness?
Yeah, okay.
No. Let's build it logically, Francesco.
Yes,
Okay. What is darkness? I'm challenging you on your first question. See, it depends on the way that you look at it. It's the perspective that matters. Okay? If I look at you as a learner, then I will teach you. But if I look at you as an intrusion, I will ignore you. Your questions will remain the same. My perception, my attitude towards you will change. Yes, you're right. How can there be rebirth after death? We don't know that theory. I don't know if there is rebirth. But in the spiritual text, they have written that there is a rebirth. But in some, they have said there is no rebirth. This is about it. So they differ. Let's leave it to that. Let's come back to science. At the base, what was there? In the beginning, what was there?
darkness. Oh,
Homo.
yes.
Yeah. Now, professor has described that as Newto. But let's stick to Homo. He calls it as primordial Homo. He used to call it as the primordial Homo. Right? What is Homo? It is full of material. You go, you go, you go to any home. Even at the end of the month, if the son comes and asks the mother, "I need 10 rupees," the mother will say, "I don't have money." The son will come and say, "I need to buy ice cream, I need to buy a pen, I need to buy this, I need to buy that." She'll say, "I don't have money, I don't have money, I don't have money." But suppose there is an emergency. She needs some milk, she needs something. She will go somewhere and bring that 100 rupees out. Or whatever that money is required, she'll bring it out. How will she bring it out? Hmm? Yeah, that is her very character. That's a homo nature. Hmm? Yeah, that's a homo nature.
But you're talking about the cycle of life, not about this application in a single human being. Because the cycle goes from homo to hetero, hetero to homo, and then he's dead. So this is the anti-creation.
No,
So we cannot rebirth for having
no.
again the
Francesco, you're mixing two theories.
okay, okay, good.
Okay?
Okay, I understand. Let's
Hmm. Okay. Dav- yeah.
let's take just a single person. It goes from homo to hetero and from hetero to homo. Is it correct?
In one perspective, yes. See, it can also go from hetero to homo.
Yes.
Hmm?
And then after homo, there is no more cycle in that person.
In life, yes, it is true. So you see this declining stage,
Yes.
you can take it as life.
Yes.
So if you're talking about my decline from brightness, hotness, heat, wind, humidity, dryness, coldness, darkness, homo, my life ends.
Okay.
I'm dead. You burn me. That's the end of my story. But if you're talking about something within me that is born and declining periodically, then this cycle is also repetitive. Are you understanding?
No, I don't.
Okay. So my cells are in full capacity. My body is functioning fully. Right? I'm a youngster. Okay. I'm in my state of hotness. When my period of decline starts, I move from the hotness to the heat to the wind, humidity, dryness, coldness. Then I'm old. I die.
Perfect.
Okay.
And from that
Wait,
point,
wait, wait,
how
wait,
can we
wait,
start
wait,
the
wait, wait,
life?
wait, 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 wait. That's why I say perspective. Okay. So I die. Now I'm taken to the cremation, whatever, my story is over. If you look at it philosophically, I can have a rebirth, but let's not touch that. You look at the same theory from a different perspective. Something inside my body, for example, a liver cell. Do you think for the last 45, 50 years I'm having the same blood cell or the liver cell? No. They are being generated, they are dying. Yes?
Yes.
So, you know, they are generated, they reach their full peak potential, and then they have to decline in the same cycle. Once they decline, at this point, you will see from the darkness, another cycle will start. It is internal in nature. Are you understanding now?
Yes.
Yes? Okay. Okay. So it is repetitive in nature. So it depends on the perspective. Right? It depends on the perspective. Okay, anyway. Yeah. The prenatal stage can be divided into two distinct stages. In the hetero stage, where the fetus or the embryo will be in the head up position, where it will undergo the steps of wind, heat, and hotness. Hetero is always movement, so it is wind, heat, and hotness. The homo stage of the fetus is in the head down position and it will pass through the energy circulation of humidity, dryness, and coldness. We have, you can make a note of this. When we come to the pictorial reference, I will show you the picture how they are represented. Okay? It's okay. This type of growth tends to follow the cyclic or the phasic pattern of energy flow. The development of the embryo to the fetus and its full maturation is unidirectional. It happens only once, it is unidirectional. Okay? This is not a process which is repetitive. Birth happens once. But if you look at it from another level, from another layer, there is birth and death happening periodically. Cell birth, cell death, apoptosis. Blood cells are produced, blood cells die. Now what happens in cancer? Yeah? So can you use a theory potent enough to work in oncology? And can we also see how we can strengthen the theory? See, let's get the theory straight first. Then look at the application part. Okay? Yeah. So this is not a process which is repetitive. So embryonal development forms the ascending phase of the life cycle, and the first type of unidirectional energy circulation will be applied, which successfully ranges from homo to hetero. To study its development, it starts from coldness, dryness, humidity, wind, heat, and hotness. Right? So coldness is the first stage. When we show you a picture, you will say what is coldness. The six energies will be related to the different stages of development at different intervals, both in their head up and head down. I've explained this to you in a very simple format that the oracle is available. In embryology, there are two stages of development. One is the head up stage, which Professor calls hetero, the head down stage, which he calls homo. And each of these head up stage, he will have head up, wind, head up, heat, head up, humidity, head up, dryness, head up, coldness. Now with this he has said, you look at it individual. He has said front back head up wind, front back head up heat, front back head up humidity, They're all different correspondences for that. If you understand this, the auricular therapy is one of the easiest subjects. Most people say, "Sir, what is this? Here is put head up, head down." They get confused. So if you're confused here, please stop me. We will clarify. We will make it very concrete and only then move on. Are you understanding the concept? Yeah? So the six energies will be related to the different stages of development at different intervals, both in the head up and head down stage. So what will it give us? This will this will give us 12 orientation, 6 with their head up and 6 with their head down, which will have a category of the 6 key and will have an independent auricular correspondence system. He's saying it in a different way, I've said it in a different way. Okay. In terms of similarity to the human body, the external ear ranks third after the hand and foot. Why? Why does Professor see that the human ear ranks third after the hand and foot? There are no protrusions. It is easier to correlate the hand and the foot, and you can look at the hand and the foot. You cannot. Nobody bothers to look at the ear. The absence of protruding parts in the ear is evident to the auricle being related to the early stages in the development of the human body, when its natural position is that of the embryo or the homostate. Okay, so it ranks third. Why? Because it has no protruding parts, and it is in the embryonal stage. It is in the developmental stages. This is completely developed. We are available here functionally. In embryology, we are available potentially. The process is kinetic. This process is kinetic. It is moving. In vitro, we are potential. We are still growing up. We are building up. We are getting stronger and stronger. Clear? Okay. Please tell me if you're not. If you have a doubt, please stop me. The ये वाला? Okay. The six energies will be related to the different stage of development at different intervals. You have six key. Yes. Along with the six key, you will, if you look at embryology, you will have head up and head down. Okay. So head up, you will have wind, heat, hotness, humidity, dryness, and coldness. 6 हो गया. Head down, you will have wind, heat, hotness, humidity, dryness, and coldness. Okay. So you get 6 plus 6. Yes. Now, I don't know if you wanted to confuse us or not, but it's beautiful. I like it because I'll tell you the advantages. A lot of people say, "Sir, he gave us this, he gave us that, but he didn't tell us where to use it." Apply your thought. You yourself will know where to apply it. I'll tell you where I've applied it. Along with this, he gave us front, back, left, right. So now, how much does it add? 6 plus 6, 12. 12 plus 12, 24. Then he not only gave us individual, he also gave us united. He gave us united open. He gave us united closed. So thereby, this full book is filled with pictures of correspondence. Okay, we will go. We will decode it logically. There is a key to that. There is, to understanding everything. There is a key. The key is there in your book. एक छोटा पैराग्राफ दिया आपकी किताब में, अगर वो पढ़ेंगे तो आपको पूरा करस्पॉन्डेंस पता चल जाएगा. बट सिर्फ उसको पढ़ना चाहिए. Our professor has given us 5 different interpretations. We will work with those 5. No, this is volume 1. Okay. He has given us a united closed left right, individual left right. So content. We will work it out. See, everything I have given it to you in the key that I have given you. Suppose, you feel that you need to go back and revise and you've forgotten. You're not having access to the video. This study material will have everything, but you need to have this. Professor has given you 5 different interpretations. There are much more. If we have time, we will discuss that here. Okay? So, united left right, individual left right, united closed front back, individual front back, and then united opened. So these are different ways that he has given. But in our spare time, we will look at other ways also with which we can interpret. But that's okay.
So, one question. We understood the 6 energies with the head up and the head down.
Yes.
Perfect. the fetus is like this,
Huh.
why we should interpret like this also?
Why not?
So according to what theory we should move the fetus inside the auricle?
See, it is a theory of utility. If you understand the fractal, the number of representations are infinite. Any representation that you make is not only structural but it is also functional. For example, they're all utility based. Suppose I need to have access to the internal organs, I will need to make a presentation like that. If I need to come for a physical examination, I will need to undress. I cannot come in a coat and a tie. My orientation, my presentation has to be different because the purpose is different. For that, I will have to be, I cannot sit like this and say, okay, do my chest examination. I cannot lie down like this and say, do a chest examination, do an auscultation, do a palpation. My presentation has to be different because the object is different. So, keeping the objective in mind, Professor has given us different interpretations. That intention will come when we look at the correspondence and then when we look at the utility.
But this is because the fetus can move inside also like this, not just with the head up and down.
Yes,
Does it derive from this, that it can move also in other ways?
possible, possible. But here he see the fetus can move in different ways in vitro. But here he has given us specific presentations. You can build it up. You can have lateral presentation, you can have transverse presentation, you build upon that. And then give us different interpretation. Because fractal field theory says the number of correspondence is infinite. So you build your own correspondence, do the treatment, and come back to us with the result. We will get it on print. Okay? Yeah. Okay. So the six energies will be आपका doubt clear करने के लिए पढ़ रहा हूँ. The six energies will be related to the different stages of development at different intervals. Six key comes in different stages. They will be in their head up and head down. So that means head up will have 6, head down will have 6. So this gives us 12 orientation. 6 with their head up and 6 with their head down. Okay? Each will have a category of 6. Each will be an independent auricular system. Right? In terms of similarity to the human body, the external ear ranks third after the hand and foot. The absence of protruding parts in the ear is evidence of the auricle being related to the early stages in the development of the human body when its natural position is that of an embryo. Hand comes first, foot comes next, the auricle comes third. Why? Because it is not fully grown, it is not fully matured. It is still in the developing stage, it is in the embryonal stage, and that is why it is not clearly visible. So it is accorded the third place. Okay. The auricle is noted for the systems found to be in correspondence relation to the human embryo. In the course of evolution, by the action of the heterophores, the human being straightens, and 5 prominent protruding parts are indicated as 5 projections of the hand and feet. From here, from nothing, he slowly comes up like this, and this is how he blossoms. So initially you will see in all embryological pictures, it is going to be like this. Even when we depict the correspondence system, you will see that the hands don't come like this. There are buds. You have seen, I've used the term buds, the limb buds. Okay? So limb buds, when do they start? If you can treat the limb buds, especially if somebody has got pathology in the phalanges. For example, you have Heberden's node. Have you heard of something called Heberden's node? You have small joint arthritis where this is inflamed. The distal phalanx, the joint is inflamed. That you have what is called as the Heberden's node, and the proximal joint you will have the Bocard's node. Very painful. Early morning, not just rheumatoid arthritis. Normal individual in their life, they will have this Heberden's node and Bocard's node. They will give you a different phenomenon. Okay, so all this you can treat with this correspondence system because you'll have the developing buds available and they're growing. Here it is static, so you may have to work a little harder. But if you look at it in terms of the ear, it is easier to treat. Okay, yeah. So, in the course of evolution, by the action of the heterophores, the human being straightens, and five prominent protruding parts are indicated as five projections on the hand and feet. The human body in its homo state will demonstrate the correspondence system in the auricle, and the body's hetero state of correspondence will be found in the hand and feet. So, auricle is homo, hand and feet is hetero. Okay? Okay. The auricular resemblance of the kidney, brain, heart, lung, stomach, pancreas, etc. is testimony to the fact that the auricle holds the correspondence system of the internal organs also. Auricular therapy volume 2 has got representation of all the internal organs. I think we did a quick review on that. We got in the liver, we got in the brain, we got in the stomach, and in different ways that you can superimpose the internal organs on the auricle, and then you can do the treatment. I also showed you the brain, how and the slicing of the brain, and how you can put each slice on the auricle and thereby treat. So suppose in one slice you have a brain pathology, you can identify that point and go directly to that point and then treat. I have seen that the hematoma resolves just by auricular acupuncture needling. I don't have a theory to explain that. I'm still lost, but my patient is happy. So if we can replicate that, then we can concretize it. Okay, so he gives you the potential here. Okay, now what are the different types of correspondence? I'm shifting gears here. I'm getting into classification. See, professor has given multiple classifications. Initially he said this is homo, then he said this is hetero or homo and hetero. So he gives you multi-layer of classifications. You're aware of that, right? So here we will also start with a different level of classification. So how do you classify the human body? In the correspondence system, you have the correspondence of the whole body, right? The primary correspondence, the secondary correspondence, and things like that. Then you have a body part correspondence. Then you have an organ correspondence. Then you have a part of the organ which occupies the whole of the correspondence system. Then you can have an individual cell which occupies the whole of the correspondence system. This is clear? So this is one way of classifying a correspondence system. Next, if you go, you will see there is what is called as the external correspondence system. You will see that only the superficial structures are there. They are connected to the integument and the sense organ. If you look at certain correspondence system, even in the book it is there that you can look at the body from the superficial part. Do you see this? Yes? It is a superficial. This is the front of the right foot, front of the dorsum of the right, dorsum of the left. So superficially it is located. Okay? So you will see in the external correspondence system, it is connected to the integument and the sense organ. In the internal correspondence system, it is connected to the hollow, the parenchymatous, internal organs, bones, and muscular tissue. So this is one way of classifying external and internal. Even in the auricular, you will have external and internal. Please don't confuse. Francesco, please don't confuse. Look at them in isolation. If you have a confusion, we will sort it out in the evening. I'll spend time with you. Would that be okay? Right? Yeah. Okay. The next way is a major correspondence. What is a major correspondence system? These occupy the whole part of the body, arm, leg, head, and trunk. It's a major correspondence system. Right? It's a big correspondence. A big chunk is occupied by the correspondence system. Then you have a medium correspondence system. They occupy single structures of the body like part of an extremity, femur, forearm, head, foot, finger or toe. You have seen a figure in that book yesterday or day before. Yes? An individual organ on the floor of the auricle and the floor of the hand, whatever. Then we have a minor correspondence system, and single body structure like phalanx, lobe, lobules of organs, cells, etc. are depicted. They are minor correspondence system. You cannot do a significant improvement. Maybe you can, but as of now, what can you do by treating one cell in the correspondence system? Can you achieve anything? I don't know. Probably if you're looking at the genetic interpretation, if you're looking at one chromosome, maybe then you can. But as of now, this classifies as minor. because you cannot have a significant change in the therapeutic system by manipulating this. Clear? This ends one system. Excuse me. The next one is the individual correspondence system. Okay, they are acting as one integral structure and functional unit of the body, like single arm, foot, finger, toe, and the auricle. Individual, that means one unit, whether it is one hand, one foot, one arm, one leg, they contain representation to the whole human body. Individual. Please remember this. The next is the united. They are active simultaneously in two symmetrical structures. This word symmetrical is also very, very important. Why? Because you can divide the body at the median into the right and the left, or the left and the right. And each of them will be superimposed either on the hand or the foot. And they are active simultaneously. The right half is available on the right side, the left half is available on the left side. The right front available on the right front, left front available on the left front. This is called as the ipsilateral presentation. Now, can I add one more twist to this? You will see in the brain, suppose there is an injury on the right side, you will see the problem is on the left side. Okay? Why? Because that is a contralateral presentation. So even in auricular therapy, in some of the books, you will see that the right side of the body is presented on the left side of the body is presented on the right side. That is a contralateral presentation. And he uses a word called kind and type. I've made notes on that. I'll orient them towards you, to you, probably after finishing one, giving you an orientation on the correspondence system. Before we get into the other phases, I will give you an orientation to that. So in the book, when you say, he will say type 1, type 2. Somewhere he will say kind 1, kind 2. You will not understand that. So I will give you what his definition of type 1 and kind 1 is. So it will be easier for you to understand. Okay? Yeah. So in the united correspondence system, these are active simultaneously in two symmetrical structures of the body, like two arms, 2 feet, 2 fingers, and 2 auricles. Individual, united. Now this is my flow chart for easy understanding. You will see that there is a homo system of the universe. Within the homo system of the universe, you have homo. See, it is just a recap. I have written it in a definition form. I have made a flow chart here. This should be in top, homo system of the universe. In the homo system of the universe, there are many human beings, and the human beings have the homo system of the human body. In the homo system of the human body, there are various correspondence systems. What are the types of correspondence system? You have major correspondence, medium, and minor. Then you have correspondence of the whole body, the body part, the organ, the part of the organ, or the individual cell. How do you classify the correspondence? You classify them based on their position. What is it? Standard and yoga. They are positional based, right? So based on the position. Then on the division, whether it's a micro correspondence, an iso correspondence, or a macro correspondence. Another way of dividing it is either it is longitudinal, elliptical, spherical. Yes? What is a longitudinal correspondence? See, you have the elliptical correspondence system wherein he says there is a muscle. You've seen that figure? Look at your study material. It is there. A bone. You see this? This is elliptical. Yeah? So we have done all these figures. I'm just giving you the classification here, because even this he has used in the auricular correspondence by creating something called as non-standard correspondence systems. Okay? Yeah. So you have it longitudinal, elliptical, spherical. The simplest example can be the insect correspondence, the bone correspondence, the muscle correspondence. You have seen the spherical correspondence where you have the lung and the heart superimposed on the palm of the hand, where you have the intestine, the large and the small intestine on superimposed on the hand, on the palm of the hand. They are the examples of spherical correspondence system. Then you have external and internal. External is what? We just spoke. Superficial, integument and sense organs. Internal is deep structures, parenchymatous tissue, hollow organs inside. Okay. In both of this, you have open type and closed type. Closed is like this, open is like this. You have the individual and the united. In them, you have the front-back representation, the left-right representation. Then you also have the head up and the head down. Now, along with that, you will have the 6 and the 8 key presentation of wind, heat, hotness, humidity, dryness, coldness, darkness, and brightness. So he has given you so many permutations and combinations. Easy? Simple? Okay. Now let's look at another classification here. See, I used to do this because when I read the book, the language was so unfriendly that I used to make notes. And these notes have become this flowchart. So you'll have multiple flowcharts. But the minute I finish one topic or one chapter, you will have one flowchart. The minute I finish another one, you'll have another flowchart. So these are all easy. You will understand this. You will see it starts with the homosystem of the universe. There's a miniature replication, homosystem of the human body, miniature replication, the various correspondence system. What is the purpose of the correspondence system? It is to protect us from disease and to sustain the body. What are the types? If it is based on a division, iso, macro, micro. If it's based on division, again, longitudinal, elliptical, insect. Okay. The size and shape is the heart correspondence in the hand, kidney in the foot, spherical correspondence system. Position is standard in yoga. We have done this. It's just a repetition. Okay. Then if you have another classification, you will see that there are major, medium and minor. In all of them, you can have external and internal. In the external, you can have a whole body or body part, but it is surface oriented. And you can also have individual and united. In the united, you can have open and closed. In the individual, can you have united, open and closed? No. Why it is one? United, you can close, you can open. Clear? Okay. So in the united, you have closed and open. Okay. Oh. Okay. I want to hold on to this. Huh? No. Okay. I want to simplify this. But before I go into this and before I go into this, I want to okay, I want to go into this. Now this will, what time is lunch break? 12:30? 12:30 is okay? So it's 5 minutes to 11. So can we take a break for 5 minutes and come back and then go stretch for 1.5 hours and we will finish the basics. Okay, I have one request. If you have doubts, hold on to that. Listen to me. Okay, just raise your hands. Because if you break my flow, then it is difficult for me to catch it. So just raise your hand, I'll come back to you. Okay? I'll make it as simple as possible. I'll repeat it as many number of times as possible. But just raise your hands, I'll come back to you. I will not leave you behind. This is my assurance. Okay? Okay, chalo. We'll take a break for 5 minutes and come back. Thank you. This is called as a PP break.